SI joint. I'm sure you've heard of that term, but do you know what it means? No, I'm not referring to the Essie nail polish brand. I'm referring to the SI joint or the sacroiliac joint. It is a frequent problem area causing pain for many people, including myself. So today I want to talk about what the SI joint is, what some common injuries are to the SI joint, and some exercises that you can do to treat your SI joint pain. So the SI joint is on the left and the right side of your pelvic region. The sacrum bone is the triangle bone at the very lowest part of your lower back. So the SI joint can be problematic on the left, the right, or both sides. You can find your SI joint area by locating the two little dimples at the lower back area. That's usually right over the SI joint. It's very close to the lumbar region. As you likely know, the lumbar spine is made up of L1 through L5 vertebrae. And then if you move just below the L5 vertebrae, you're going to hit the sacrum bone, or that triangle bone. The sacrum runs from S1 to S4. And that region is a region that is supposed to be very, very stable. You see, the lumbar spine and the hip joint are very mobile joints, so the sacrum region has to be very stable. The only issue is, sometimes it's not. Essentially, the sacrum is what connects the lumbar spine to the pelvis. So let's take a closer look into what can cause some problematic issues at the SI joint. You can injure the SI joint region in a number of ways. You can injure the muscles and ligaments surrounding it by spraining or straining that area. You can get some arthritic changes there. You can also get some malalignment issues where things kind of shift out of place a little bit. And you can also have an instability there, meaning too much movement. On a side note, pregnant women can also have SI joint issues. And that's essentially because hormones released during pregnancy that cause their ligaments to relax and kind of loosen up to allow that pelvic region to stretch out to make room for baby. And as a result, the SI joint can get really irritated and inflamed because it's no longer as stable as it needs to be. This is just another reason why SI joint problems tend to be more common in women. Now keep in mind, some of those causes for SI joint pain are going to cause pain right over the SI joint region. However, SI pain can also radiate or spread. It's commonly spread down along the sides of the sacrum bone. It can spread into the glute region, into those muscles, out to the hip bone, down into the front of the groin, and even down into the thigh slightly. You see, it can be a little bit difficult to properly diagnose pain in the lower back hip region because all of that area can radiate and refer pain elsewhere. So you could have an issue coming from the lumbar spine that's referring pain down near the sacrum SI region. You could have pain caused by the hip bone radiating pain up into the glutes SI region, and vice versa. So if you are someone who is unsure if you are truly having pain due to the SI joint region, I highly recommend you visit a physical therapist for proper evaluation and diagnosis to be sure what is truly causing your pain and discomfort. For example, I used to, as a physical therapist, see a lot of patients that would come in and say, I'm having lower back pain, what's going on? And ultimately I would figure out it was their SI joints and not their lower back, lumbar spine at all. It's really kind of this, small area that sometimes it can be confusing. So you really want to go to get differential diagnosis to determine what the true cause of your pain is. So what does SI joint pain typically feel like? Well, it's obviously going to vary person to person. I can tell you from experience of what I feel and what I've heard from my patients in the past who have had SI joint pain is that it's typically of a feeling of like a dull achiness, maybe some stiffness and tightness in that region. Those are the most common complaints, but occasionally I would hear things like a shooting or sharper pain as well. Now, thinking about what specific movements or things can cause the pain or bring on the pain, make it worse, Once again, that will vary person to person, but commonly things like standing for a long period of time can bring on the pain, bearing weight on one leg more than the other, using stairs, going up or down stairs, that kind of weight shift side to side, lying down with the legs fully extended out in front of you straight, so putting some extension in the lower back, as well as doing unilateral exercises. For instance, lunges, lunging with a twist, anything that puts the back in a slight extension and compresses on that SI joint can typically cause SI pain. So why do some of those movements cause SI joint pain? Well, the pelvis isn't glued together on each side. It can move separately. So one side of the pelvis can rotate or translate or kind of shift up or down compared to the other side. So anytime you move or do an activity where things can be different from left versus right, unilateral work, that's when you can typically irritate that SI joint, when things are not balanced. This is one reason why I saw many patients who had scoliosis in the spine or leg length discrepancies that also had SI joint pain. If you think about it, when you have a curve, it throws off the levels of the hips, one leg is longer than the other, and now the left and the right SI joint are no longer working together, they're a little bit off. And that can cause one side to be a little bit more inflamed and irritated than the other. Another cause of SI joint pain that I typically saw was someone coming in after, say, like a fall or a car accident. If you are getting into some sort of traumatic injury when the left leg and left pelvis is off versus the right, it can commonly cause an SI joint problem. So say, for example, one of my patients, she fell out of a hot tub into kind of like a split position. So one leg was forward and one was back. Well, that can definitely cause the SI joints to shift opposite of one another and no longer be in balance. You can also get an SI joint problem just simply from misstepping. Let's say you're walking down the stairs and you're on your phone and all of a sudden, boom, you step like really hard down because you were distracted when you're walking downstairs. Even that simple misstep can cause a shift in the pelvis because there's a lot more force and weight going up through one leg. That can shift the pelvis completely and cause a malalignment in the pelvis as well. And lastly, it could be from a lifting injury, whether you're lifting furniture or you're at the gym doing a deadlift. A lot of people will get low back pain as well as SI joint pain from deadlifting or lifting heavy. Some people just have no darn clue what caused their SI joint pain. I asked this question on Instagram to see what common causes were, and one gentleman was like, you know what, I have no idea, it just started one day. So that can happen as well. It doesn't take much for the SI joint to just kind of shift out of place slightly, could even happen in your sleep, and for you to wake up with that pain. So keep in mind, it may not be anything you're doing wrong, it's just sometimes your anatomy, your bone structure, muscle imbalances, activities, the way that you sit, little things like that can add up and cause these imbalances from the left to the right to occur, which can lead to SI joint pain. My story with SI joint pain. When I was in college, I was a cardio addict. I was always either running or using the elliptical. And as a result, I think that high impact and constant weight shift back and forth with a lot of repetition, I'm talking like 1 to 3 hours a day I was doing of cardio. I know it was dumb. All of that repetition, I think, really inflamed my SI joints. And so one day after using the elliptical, I lied down on the ground, on my back, legs straight out, and I went to get up. I couldn't get up. I think my right SI joint shifted out of place during that elliptical session. I had pain directly over my right SI joint. It also spread slightly down the side of my sacrum into some of my glute muscles. I had to give it about a week or two. I iced it a lot, took some anti-inflammatories, gave it some time to calm down, and it did get better. But I think that's partly due to the fact that I was in PT school at the time. So some of my friends assessed it. We did a quick technique to manipulate it, got things back level again, and then I just kind of let it rest and recover from there. Once I started feeling better, I immediately went and put myself onto a glute strengthening program. I knew from PT school what exercises I needed to do because I learned about SI joint issues. I knew what I needed to do, so I started on it, and ever since then, I prioritized strengthening my glutes. Not only because it has helped my SI joint region, it also has helped my knee issues. So having stronger glutes not only helps you build up your booty, but it helps stabilize the SI joints and can also prevent future injuries in that region. So as a result of focusing on glute strengthening work, I probably have an SI joint flare up maybe once a year now. And that's just when I'm just being dumb and, trying to deadlift heavier than I should, and I'm getting fatigued and I need to just stop, but I keep going, something like that. It's definitely preventable. I know what I need to avoid, and I know what I need to do to prevent future injuries, and that is doing glute strengthening work. So let's get to it. I'm gonna share with you my favorite SI joint glute stability exercises. There is absolutely nothing fancy about these. Some of them look very basic. Some of them you may already be doing, but the truth is, they work. They really, really work. I'm gonna show you these exercises. The only thing that you need is a mini band or glute loop. Besides that, you can do all of these exercises at home, and I recommend you do them on a daily basis with higher reps. 3 sets of 20 to 30 reps is going to be my recommendation for most of the exercises in this program. Personally, I felt better when I did bilateral work, and that is also why I usually prescribe that more for my patients and clients, bilateral work, because it worked for me, and most people have the same symptoms that I did, where unilateral work is a little bit more uncomfortable. It's always going to be best to get a custom treatment program or rehab protocol for you. However, if you're someone who knows that you have SI joint pain, you know that you have an instability there, and you just want to know what exercises you can do to stabilize the SI joint more, then I'm going to share with you an SI joint stability program that I put together based on my knowledge and my personal experience with SI joint pain. 90% of my SI joint patients that walked in the clinic with SI pain had just something shift out of place. We did muscle energy techniques, manipulations if needed, to get it shifted back into place, and then I put them on this glute strengthening program. SI joint stability comes from the glutes being stronger. The glutes surround that whole SI joint region, so if you can build up the strength in your glutes, your SI joint is going to be much more stable. Here we go, the SI joint stability program. Before I show you the glute strengthening exercises for SI joint pain, I want to show you 2 of my favorite stretches to stretch out that lower back SI joint region. These are probably great ones to do when you're currently in pain, having discomfort. They're also great exercises to add into your pre-workout mobility routine to kind of warm things up a little bit. So when I am in pain, these stretches that help me, number 1, double kneed chest. So just lying down, pulling both knees in. All right, go in as far as you can. You can kind of rock side to side a little bit as well. Kind of massages those SI joints, which feels good. So this is my favorite one. You're just taking your spine into spinal flexion. So you're just gently elongating those paraspinal muscles that run down into the lumbar region and just gently flexing that sacrum too. So I like that one. I also just like doing a child's pose. So if you're having discomfort, just sitting back on the feet, reaching the arms out in front, palms up, rounding the spine, holding it there. If you're having pain on the right side of your SI joint region, reach the arms to the left, and that will put a little bit more stretch on the right side for you. So curve the spine, make like a C curve, palms up, and hold it there. So 2 of my favorite stretches for when I'm experiencing some discomfort. I'd also like to briefly show you how I sometimes get relief by doing a self-mobilization of my SI joint. You can do a spine twist exercise. Straighten out one leg, bend the problem side. So my problem side is my right SI joint, tends to shift out of place occasionally. I'm going to reach my hand to the outside of my knee, other hand on the mat. I'm going to rotate my spine, twisting the hip down, bringing the knee toward the ground. Usually if I do this a little bit quicker, I'll get a nice little manipulation, a little pop there in the SI joint lumbar region. And that usually fixes the problem for me. Now obviously everyone's different, but personally that usually shifts things a little bit for me. Then I'll do some muscle energy work, and then I'll get into my glute strengthening work. So it's very, personalized, but I just wanted to show that stretch because it oftentimes feels really good for me to kind of gap that L5, S1 region of the sacrum. Okay, one more thing, I promise, just one more thing before the glute strength work. That is, I don't want you to completely ignore the importance of the core. Your abdominals also provide very good stability for the entire lumbar pelvic region as well. So doing some core work will also prove to be very beneficial for you if you're experiencing SI joint pain. My two favorite core exercises are going to be dead bug and bird dog. Let me show you those briefly. Dead bug is the exercise that starts like this. You're reaching opposite arm, opposite leg while engaging the core, trying not to lose engagement and extend the spine. Engage the core, keep the spine neutral, lifting opposite arm, opposite leg. Just working on stability, keeping those hips as level as you can. So I've showed you a few of my favorite stretches, a few of my favorite core exercises. Let's finally get to the glute strengthening work of the SI joint stability program. Exercise number 1, supine hip abduction. Grab your mini band, hip thruster loop, glute loop, whatever you got. Tie a band around the knees. Then put it just above the knees, lie down onto your back. Feet hip distance apart, arms at your side. Keep the core engaged. When you're ready, all you're gonna do is press the knees out and in. Very simple, abducting the hips. It's okay to roll out onto the outsides of your feet slightly. We're now going to move on to the second exercise, which is the supine glute bridge with 5 band abductions at the top. I'm going to preface this by saying this is my number one favorite exercise for SI joint pain. Not only because this is the one that I learned in PT school for being the favorite amongst most of my professors, but also because personally, this is my go-to. I will work on doing 50, 60, 70, even 80 repetitions of these, and they do the trick. So if you get nothing else from this video, remember this one exercise and try this out next time you're having issues. So this is the glute bridge with 5 abductions. So it's gonna look like this. You're gonna bridge up, squeeze the glutes, 5 presses at the top, out into the band, lower it back down. That is 1 repetition. Up, 5 presses, that's 2. That's 3. If you do not have a mini band, don't worry. You can still do the glute bridges, just body weight version without the band press at the top as well. Just like this, that's totally fine. I also want to mention that personally, I like to elevate my head a little bit when I do any glute bridge work. The reason is, if your head is slightly more flexed, it's going to essentially kind of turn off some of those back paraspinal muscles, so that when you bridge up, the back paraspinals don't work as much, so the glutes have to work more. So, find like either a Bosu, pillow, towel, foam pad, whatever works for you, and try it out. I mean, you don't want your head so high that it hurts your neck, but just a little bit of elevation. Keep the chin tucked to the chest. Helps me feel it a whole lot more in my glutes, because now my back can't help as much. And then also, don't forget, you want to have a little bit of a posterior pelvic tilt at the top. So instead of going up like this, tilt it. Draw those front pelvic bones in toward those top ribs and pull the belly button to the spine. So now we're gonna do hip adduction, squeezing the knees in. So place the pillow or towel between the knees, and all you're gonna do is literally squeeze in, hold for like a couple seconds, and then relax. Squeeze in, and relax. So we are working the adductors or the inner thighs now. However, they do play a good role in stabilizing the pelvic region as well. So it's not all glute work, it's mostly glute work, but it is good to do a little bit of adductor work too. Go ahead and grab your mini band again, place it above the knees, lie on your stomach this time. We're gonna do a prone heel squeeze. Looks like this. You're lying on your tummy, knees are apart, but the heels are together with the feet flexed. All you're gonna do is squeeze the heels together and then lift the thighs off the mat 1 to 2 inches. So squeeze the heels, lift it up, you're pushing out into the band as well, and lower. So it's a squeeze, lift, lower. So you're gonna feel those glutes firing like crazy, especially with the band on. You can do this without the band, totally fine as well. But this is a Pilates-based move called the prone heel squeeze. Now without the band on, we can also do some other prone exercises. I like to do just a hip extension, very basic, extending the hips. You can do one at a time as long as that's not painful for you. But you're focusing on lifting from the hip. I'm not bending the leg. I'm not just lifting the foot off the ground. I'm trying to lift the entire thigh off the ground here. Now the hip abduction with the band can also be done in sitting. So, just like so. Same thing we did in supine with the sitting version. It's gonna have the hips flexed a little bit more, so just the setup's a little bit different. To finish, a more functional exercise would be to do some squats with the band. Squatting is something you do throughout the day. Squatting down to pick up groceries, squatting down to pick up your baby, whatever. This is a great functional way to do the knee banded body weight squat to work on really engaging those outer thighs and glutes when you're doing a more functional movement. Just squat up and down like normal, but make sure you're really intentionally pressing out into the band the whole time. I think that's it, everyone. Dang, that's a lot though. Anyways, hope you found those exercises helpful. If you did, I would love to hear from you. Comment below. Tell me your story. Tell me how the exercises went and if they helped you out with your pain and discomfort. I would also love it if you liked and shared this video. It would mean a lot to me. Thanks so much for watching.